NPSF was founded in 1997 to serve as a central voice for patient safety and to identify and create a core body of knowledge in this field. By bringing together all stakeholders, including patients, NPSF has promoted research, education, and professional development and has raised public awareness about patient safety. Our goal is to prevent harm and save lives by helping to transform the healthcare industry to one where safe systems and practices are the norm. The Foundation's legacy programs have helped to establish patient safety as a science and a professional discipline, defining principles and best practices, while at the same time fostering research and thought leadership necessary to advance the field. We're expanding the reach of existing programs that have proven most successful, while enriching our capacity for advocacy and promoting patient safety at the policy level. With additional resources, we could also do much more to further research and expand education nationally and internationally. Key to NPSF's success is how we engage organizations and individuals to address our shared responsibility for safe patient care. We reach across all healthcare disciplines, from leadership to the front lines of care, in a carefully designed strategy to ensure each voice is heard and is contributing to the mission. Our programs touch leaders and staff of healthcare organizations, patients and patient advocates, researchers, governmental agencies, regulatory bodies, and those in industry. What makes us so effective? Collaboration. NPSF is at the heart of the patient safety movement and has built an industry-wide reputation for creating meaningful resources to keep patients safe. We excel in gathering different participant groups around a central goal, and our governance is comprised of leaders with experience in health systems, regulations, and advocacy. Their insights and expertise ensure that the Foundation is delivering innovative programs that have a real impact. NPSF has gained undisputed credibility as the only organization that is totally focused on patient safety. We measure our impact through the growth of our member-based programs, enrollment in our educational offerings, and the rapid increase in the number of professionals pursuing certification in patient safety. As thought leaders for the field, the Lucian Leap Institute members develop white papers and articles that address transformational concepts for making sustainable improvements in patient safety. NPSF works to ensure that the findings of these papers are elevated to the level of national policy discussions. Because NPSF has a global reputation and focus, it may seem that we have a large staff and significant resources. In truth, NPSF has a small, deeply committed professional staff with limited operational resources. We do much with little and see much more that needs to be done, yet are constrained by financial limitations. Similarly, our name implies to some that we are a patient advocacy group. Although we work with patient advocates and families touched by medical error, individual cases are more appropriately directed to other channels for reporting and support. NPSF has played a key role in framing patient safety as a public health issue. By leading the effort to introduce certification in patient safety, we've helped establish core competencies for a field that is evolving as a specialty career path in healthcare. Raising public awareness and fostering communication about patient safety has been central to our mission. Thought leaders from the Leap Institute are at the forefront of surfacing critical issues in healthcare, such as workforce safety as a precondition to patient safety, and the transformation of medical education to better support patient safety principles. Healthcare budgets are shrinking, and competition for fundraising and development has increased. While it is vital for healthcare organizations to invest in patient safety, leaders of these organizations are often faced with competing priorities, and many have reduced investments in patient safety education for their providers, which presents a challenge to NPSF as we seek to sustain our programs. As healthcare costs become a greater focus for most health systems, we need to ensure that safety does not get compromised. There are many patient safety issues, for example, end-of-life care, mental health, and patients' involvement in their treatment, which are critical as care moves to the outpatient setting and the home. Additional funding would allow NPSF and the LEAP Institute to explore and create improvement strategies to advance patient safety in these broader areas and to elevate patient safety as a health policy issue. While research is largely focused on hospital care, the vast majority of healthcare today is delivered in long-term care facilities, ambulatory care centers, and the medical home. In order to reduce error and mitigate harm in these environments, increased research funding is necessary. Patient safety is also a public health issue in developed countries and a more sizable issue for emerging and underdeveloped nations. Ideally, we would offer resources in many languages and addressing variable levels of understanding and health literacy. Although we are the National Patient Safety Foundation, our critical mission could have a huge impact beyond the U.S.